Hi, this is Martin Mulders. I just wanted to show you how easy IASIS microcurrent treatments are done. So I'm going to demonstrate this here on my wife Kim. So what I'm going to do is just connect the cables and show you how it's done. It's a very easy, painless, non-invasive treatment for all kind of various problems, including anxiety, depression, insomnia, OCD, PTSD, and other issues. What we first need to do is clean the skin. Make sure the skin is free of oil because that will interfere with the transmission of the current. We have this paste here that we use for that, and it's really a little teeny bit of a scrub or two makes the current conducted better. I'm demonstrating it now with the basic points. There are other points we can treat also. Then we have here this conductive paste. It's a water-based paste that helps the wires stay in place. And the particular wires go on very particular spots. They attach very easy. And it doesn't hurt, which is a great advantage. The treatment, you don't feel it either. The current is so small. So when I pull up the microcurrent program, we can even see in the program that we're connected well because all the lights are green. Then we choose the program we're going to do and make sure we're connected. And then we get started. So now Kim is receiving the microcurrent treatment, which usually goes for about a minute in each spot. Depending on the situation and the results, we extend that time. Sometimes we shorten it. And we can also add other spots depending on what the goal is and what the issues are. So as we are going through the treatment, the spots may change and the time varies and gets extended often. In general, we always recommend people take at least 20 treatments. Although there are some people who find after 10 it's good. In general, we see results within 3 to 5 treatments. On occasion, people feel just better after one already.
My greatest benefit with the IASIS has been from several years ago. I was involved in 2 consecutive car accidents and I was left with a traumatic brain injury and I was not able to drive. And if I did drive, I always had to be at the wheel. I had so much anxiety in the car that no one else could be driving. But that anxiety carried over not only from a car situation into my activities of daily living, it affected my sleep. It's almost like a PTSD I had from the accidents. So the IASIS has greatly helped.
So now we can change the location of the wires, which are very well-established points that are used in doing EEGs.
I would add too that I have had so many painful procedures done on myself in regard to musculoskeletal issues from these injuries and a lot. This treatment is so quick and easy. It's painless. I feel more relaxed even by the time the treatment is completed. It's been a huge help for me. I'm not sure where I'd be functionally and cognitively without these treatments. I'm very grateful.
There we go. So, and then we do a minute on this spot and then the treatment is over. Many times people feel something as it's happening, not necessarily they feel a current, but they suddenly feel relaxed. It's really quite impressive when, when a person who feels very anxious, the first time we do this says, could it be that I feel less anxious? That's kind of amazing and quite exciting. Good. And then when the treatment is finished, we just remove the wires. And then we have to clean up the skin here, remove the remnants of the paste.
And I think what I like about these treatments, as opposed to other treatments, there's no active involvement on my part. I don't have to listen to a sound or strain to see something on the screen. I can just sit here and relax. It's very simple, but it's very powerful and effective. It has helped me so much. Anxiety, sleep, cognitive ability, Driving. Martin can drive.
I can drive again. For 4 years, I couldn't
Me in the
drive.
car.
She was so anxious, she made me anxious. What can happen with couples when they're in the car? I always joked, many times a couple is on a long ride and they get in an argument and it turned out they were hungry. Of course, most couples know about that, but, this was so bad that Kim could only feel good if she was in control of the wheel.
Yeah.
And even however careful I was with driving, it didn't matter. Where somebody would put their brake lights on 100 yards ahead and she was squeezing the door to just manage her anxiety in the car.
With that car anxiety, it didn't just stay at car anxiety. That anxiety spilled over into other areas of my life as well. Sleep, just functioning during the day. It didn't just stay compartmentalized, it just spread. So the IASIS has just helped me tremendously.
Good.